Hello everyone, how's it going? Millions of Americans are suffering from chronic fatigue syndrome. Are they just tired all the time? Is it all in their head? Well, what are some of the symptoms and how is it diagnosed? Have researchers come up with a blood test to help with the diagnosis? Well, if that sounds interesting to you, then keep watching. Chronic fatigue syndrome is a complicated disorder. It involves much more than being tired. That being said, it can be difficult to get a diagnosis. There's no one test that can help confirm that someone has chronic fatigue syndrome, and many of the symptoms are actually similar to that of other illnesses. Now, some people have been made to feel that it's all in their head, which is very sad because chronic fatigue syndrome is a very real and medically recognized condition. After decades of research, the results show that people with chronic fatigue syndrome have biological abnormalities, including immune system dysfunction, brain irregularities, energy metabolism issues, and gut microbiome changes. So what are some of these symptoms that are experienced? Well, there's extreme fatigue lasting at least 6 months, worsening symptoms after physical or mental exertion, unrefreshing sleep, cognitive issues such as brain fog or memory issues, muscle or joint pain, and possibly even dizziness, sensitivity to light, sound, or chemicals. So how is it diagnosed? And will there be a blood test in the future that can help diagnose chronic fatigue syndrome? Well, we're going to discuss that next, but first, a few reminders. Please like and subscribe if you're enjoying today's information. Also, remember to feel free to leave a comment below if there's something you'd like to share on this topic. And in the description box, there'll be links so you can see where I gathered the information for the video. Okay, so how is chronic fatigue syndrome diagnosed? Well, as I mentioned before, there's no single diagnostic test that can confirm chronic fatigue syndrome. So a doctor would need to rule out sleep disorders such as sleep apnea, restless leg syndrome, insomnia. Other medical problems may need to be ruled out, such as anemia, diabetes, an underactive thyroid, and mental health issues such as anxiety and depression. Now, it's not unusual for people with chronic fatigue syndrome to also have other medical problems, so they actually have to meet a certain diagnostic criteria. The fatigue needs to be so severe that it interferes in the person's ability to engage in activities that they were able to do before they became ill. The fatigue needs to be definitely new with a clear onset. The fatigue is not substantially alleviated by rest, and the fatigue is worsened by physical, mental, or emotional exertion. The person would also have to experience difficulty with memory, focus, or concentration, and/or experience dizziness that worsens when moving from lying down or going from sitting to standing up. All of these symptoms lasting for 6 months or more. So what about this blood test? A study published in the Proceedings of the National Academy of Sciences reports that researchers identified specific molecular patterns in the blood that distinguished chronic fatigue syndrome patients from healthy individuals with up to 77% accuracy. Now, while this diagnostic tool is not ready to use, it is encouraging how the research offers hard evidence that chronic fatigue syndrome is rooted in measurable biology. So in the future, this could become a reliable clinical tool, and it may even help researchers develop targeted treatments. Now, this is good news because many patients have felt like their symptoms have been dismissed and they struggle to receive proper care and benefits. There is no cure for chronic fatigue syndrome. However, it will be nice if people that are suffering can receive an easier diagnosis and therefore validation for what they're experiencing. Even though there's no cure for chronic fatigue syndrome, there are certain things that can be done to help alleviate or reduce the symptoms. Number one, being medications. Some medications can help with pain, can help with those who suffer from feeling faint, dizzy, or nauseous when getting up after sitting or laying down. Also, medications can help with depression, which is something that can occur when someone is dealing with a chronic illness. Number two is pacing. So people with chronic fatigue syndrome have to come to terms with how much they can do. The symptoms may worsen after physical, mental, or emotional exertion. It's actually called post-exertional malaise. And this can sometimes lead to a person being bedridden for days. So those with chronic fatigue syndrome actually, they need to find a balance between remaining active and not overdoing it with certain activities. And the Mayo Clinic suggested keeping a daily diary so you can keep track of how these activities make you feel and how long it takes you to recover. Number 3 is to address sleep problems. So you may want to take a look at your bedtime routine, maybe make some adjustments, possibly consider avoiding or reducing your caffeine intake, and making sure that you definitely do not have sleep apnea, because you may need a CPAP machine in order to get the proper sleep that you need. Now, according to the CDC, chronic fatigue syndrome is a chronic multi-system illness, and about 9 out of 10 people with chronic fatigue syndrome have not been diagnosed. The good news is that more and more people are coming to realize that chronic fatigue syndrome is a legitimate disease that needs to be addressed. Healthcare professionals are becoming more aware and educated on the topic, and as research keeps advancing, we can expect to see better diagnostic tools and treatments. Well, I hope you've enjoyed today's information, and I hope to see you in the next video where we'll discuss another way we can improve our health.